also thank the Noble Lord Patel for securing this timely debate. One of the lessons of history is that so often we fail to learn the lessons from history. I say this in particular in relation to prostate cancer. Prostate cancer is the most diagnosed cancer in men aged over 45 in England. There are higher risks of prostate cancer linked to aging, black men, and family history. But early diagnosis is critical. Survival is nearly 100% when detected early, but drops to around 50% at stage 4. Yet 1 in 5 men, that's 10,000 annually, are still diagnosed too late. Despite these earlier warning signs, there is still no UK-wide screening programme for prostate cancer. Now, this is a cancer that affects men from every social and professional class. Some of the most well-known names in the world have spoken of their prostate cancer diagnosis. Some of them are still with us, others not. They include Robert De Niro, Warren Buffett, Colin Powell, and Nelson Mandela. Closer to home, this cancer has affected Ian McKellen, Stephen Fry, Rod Stewart, Andrew and Gillian Lloyd Webber, and another knight of the realm, Chris Hoy. I mention these names because the fact that these famous men have been prepared to discuss their personal diagnosis has helped expose the need for more active screening. But although prostate is the most frequently diagnosed cancer amongst men in 112 nations, the testing procedures vary greatly from country to country. For example, some nations like Sweden have trialled organised screening programs involving PSA, that's prostate-specific antigen blood tests, and subsequent MRI, that's magnetic resonance imaging tests for men of a certain age. But America and Australia have elective individual decision-making approaches. So my first question of the Noble Minister is, what analysis of other nations' prostate cancer treatment strategies is the government carrying out? And have they come to any conclusions as to the way forward for the United Kingdom? Organisations such as Prostate Cancer Research, and the British Association of Urological Surgeons all support the introduction of a screening programme. The Telegraph newspaper in recent months has been campaigning for men at the highest risk of the disease to be offered a test. According to Prostate Cancer Research and Deloitte, targeted screening is not only life-saving but cost-effective. Their modelling shows that it could deliver a £14,000 net socio-economic benefit for every high-risk man diagnosed. Of course, bearing in mind the reluctance of some men to submit themselves to rectal examinations, what assessment has the government made of the Barcode 1 study on the early detection of prostate cancer using saliva samples to identify high-risk patients? Now, I'm pleased that the UK National Screening Committee has now recommended national screening for men aged 45 to 61 with certain confirmed DNA gene mutations. But when will they next be considering whether to extend this to other men at risk of prostate cancer? As for cancer more generally, NHS England has advised caution when making comparisons between historic and latest available data on cancer. This is because cancer registrations in England can take up to 5 years after the end of a given calendar year to reach 100% completeness due to the continuing collection of late registrations. Because if we can't get the data right, how can we have confidence in the information being provided? Additionally, diagnosis of cancer are registered for each separate cancer. So this means that a person diagnosed with more than one type of cancer would appear more than once in the total data. So as Lord Kakara said, data is vital. I'm a vice chairman of the Artificial Intelligence All-Party Parliamentary Group. Can the Noble Minister indicate what plans there are to improve medical data collection? Because this is key, perhaps by using more AI technology? Also, what plans does the government have to invest more in AI and robotics to help spot cancers earlier and increase access to innovative cancer treatments as soon as they become available? Regarding international comparisons, the UK has lagged behind other countries on mortality rates. According to the Organisation for Economic Cooperation and Development, that's OECD, their data on deaths from cancer in developed countries show that we rank 26th out of 36 countries for cancer mortality rates presently. And it's against that background that I welcome the government's publication on the 4th of February of this year of their 10-year National Cancer Plan. But I note some cancer and public health academics have been critical. For example, at the London School of Hygiene and Tropical Medicine, they raised concerns with the plan's delivery model, arguing that it lacks clarity on what additional resources and leadership capacity would be required to achieve its ambitious goals. A relevant issue is the terminally ill adults end-of-life bill. An important factor in end-of-life management is palliative care, pain relief. Yet in the UK, some independent hospices rely on charity to fund up to 70% of their costs. Well, Lords, the quality of palliative care is very much a postcode lottery. Will the government consider putting more funding into palliative care? My Lords, the good thing is that, on average, we are all living longer, but our life should also be measured in its quality, not only in its length. So much of cancer care depends on the power of the purse, but we also need more emphasis on prevention and early detection. As the saying goes, cancer can be a dark place to be in, but we can bring light.